Surprised and a little panicked at first.
Parents in Avon scrambling to make accommodations for students tonight. As we've reported, all schools in the district are shut down for 2 weeks because of one confirmed coronavirus case.
News 8's Travis Robinson spent the day in Avon today. Travis, what are you hearing out there?
Well, it's actually more like 4 weeks, because as soon as that quarantine lifts in 2 weeks, it's spring break. So that's a lot of time that parents didn't really account for, and it's left them scrambling.
When coronavirus was confirmed in Avon, that was troublesome enough. But when it was followed up with school closing for 2 weeks, parents had to try to figure out what to do, and fast.
Several of my friends and I were chatting on text, and we were all kind of surprised and a little panicked at first, but we all kind of talked each other down, and after a few minutes, I think we were okay.
Many families who rely on school for food were able to pick up 10 days worth of supplies from around the district. Avon Community Schools said not to approach any of these families. They did tell us, though, that over 300 food packages were distributed and that the food had already been paid for by their food department for the regular meal service. Online, community members have come forward asking for help with their needs and what they can do to help.
Maybe not come together for a little bit, and then I've seen everyone kind of, okay, let's just come together and enough with the extras. So I have seen some of my mom friends, okay, let's rally up, who needs some stuff.
Michelle Logan is a stay-at-home mom, so luckily, she doesn't need to worry about getting childcare for the next couple of weeks. I got a peek into what her kids' lives will look like through the quarantine as they focus on e-learning and try to avoid some boredom at home during their time off.
I was so happy till again they said e-learning day, Monday through Friday. I wasn't happy.
For kids, it's a bit of a bummer because they miss school competitions and their friends, but parents are happy they're staying safe and get to spend some quality time with family.
I really look forward to summertime and us spending time together, so this is just a nice excuse, and I don't have to go to the gym, and this is great.
Now, I asked parents on Facebook exactly how they felt about the school closing down for a couple weeks. Many of them said that they adjusted pretty quickly and it's all right. Others said that they need more people to send them wine and ice cream to get them through these next couple of weeks. But overall, they said they're happy with the school's decision, that their kids are staying safe and nice and cozy at home. I'm Travis Robinson, Wish TV News 8.
Travis, thank you very much. Hendricks Regional Health has launched a 24-hour hotline offering free coronavirus screenings so far. They've received more than 100 calls. News 8's Ali Hodges has more.
Doctors here at Hendricks Regional Health Hospital have been working around the clock, taking your phone calls from their mobile device.
I've reached the Hendricks Regional Health Coronavirus Hotline.
Hi, this is Dr. Freeman from Hendricks Regional.
Hendricks County Health has been staying busy since a second person has been confirmed with the coronavirus in the county Sunday night. Doctors say many parents have been calling worried about their children. And to deal with the high volume of calls, they're adding more doctors to help. The Indiana State Department of Health has also been busy adding more staff to their hotline, too. Hendricks Regional Health's hotline is educating callers on the coronavirus, calming fears, and telling them what to do next if symptoms occur, like fever and shortness of breath. And although the hospital's emergency rooms haven't been overcrowded, they're asking people to call the hotline first to be screened.
Their biggest concerns are, how sick am I? Am I sick enough that I need to be seen? And if I need to be seen, is that my primary care's office tomorrow? Is that an immediate care this evening? Or do I need to go to the emergency room?
Health officials say many people calling the hotline are experiencing mild symptoms, and they continue to tell patients to wash their hands, use hand sanitizer, and avoid social contact. The number to the hotline is 317-520-5500. That number can also be found on our website. Reporting in Danville, I'm Aaliyah Hodges, Wish TV, News 8.
Aaliyah, thank you. Right now, hundreds of EMTs and paramedics are making sure they're ready in case someone with the virus gets into their ambulances. Interesting angle here. News 8's David Williams shows us how they're preparing.
Some patients coughing. There could be some contaminants on all the surfaces.
This is how Indiana's largest EMS service disinfects their ambulances from infectious diseases, including the coronavirus.
So it's a lot like you would clean your own home. With Clorox wipes, bleach wipes, disinfectants, wiping down all the surfaces.
After every single run of any of their 32 ambulances, they sanitize and change out anything a patient touches. It's standard protocol. Indy EMS has 330 EMTs and paramedics on the street working 12-hour shifts 7 days a week. These first responders stand ready for whatever virus has come into these ambulances.
It's just second nature for them, so they're doing their jobs as they've been trained to do.
So if an EMT does take someone to the hospital that winds up testing positive for the coronavirus, as long as they're wearing this protective gear, I'm told it is right back to work immediately. If not, they must follow CDC guidance, which could include 14 days in quarantine. In Indianapolis, I'm David Williams, Wish TV, News 8.
David, thank you very much. We talked with Governor Eric Holcomb this morning, and here's what he had to say about the state's response.
We are dealing with it right now in a very coordinated way. It's all about partnerships, whether it be local, state, and federal. It also takes into account the partnership we have with you, the citizen, and staying informed.
All right, so let's bring in Dr. Mary Gillis now. Mary, there are conflicting reports. We want a lot of information out there, right? We want to try and break it down for our viewers. Can you explain the different ways this virus is transmitted?
Sure. So there are 3 ways in which this is transmitted. So direct contact, right? We're talking handshakes, we're talking hugs, we're talking high fives, and we're also talking kissing, okay? So saliva, body fluid. There is indirect ways. And this is why we're encouraging what's called social distancing, staying 2 meters away from people. So sure, when we sneeze, right, we have fluid droplets come out.
Sure.
But when we cough and when we talk, we do too, which people really aren't aware of. So if those fluid droplets then either get on the person, around the person who is infected, and then, or maybe even get into their mouth, then they can be contaminated. The third way, and this has been conflicting reports, but Harvard University researchers came out to say today and said that surfaces can carry the virus for a couple of hours or up to a couple of days. So we're talking about doorknobs and elevator buttons, so stuff like that. But we're also talking about softer surfaces such as carpets and clothing and money. That's much less so, they're saying, but it's still something that we'll continue to look at, and it is possible.
Yeah,
Still
interesting.
trying to figure it all out. The next question, kind of two-pronged. Is there a shortage on the testing kits, and how are some people getting confirmed diagnoses and others are not?
It's a great question.
Right.
So last week, Vice President Pence said that we have a shortage. We have a shortage of testing kits. Just a few days ago, Secretary of Human Services Alex Azar said, no, contradicted that statement. He says, no, we're okay, we're fine. We have 1.2 million that are going to be dispersed around the country by the end of this week. So I think we're okay. And that we continue to ramp up the testing kits and they're getting distributed. Second thing, why are some people is it taking 2 days to get a diagnosis while others are getting a really quick turnaround, getting immediate results? So the CDC developed the kit. And when a specimen can be tested at the CDC to get an outcome, those who are tested, who are in close proximity to the CDC, are going to get a quicker outcome than those who are living in Seattle or California.
Interesting. My mom was actually tested in Pennsylvania, came to be negative, but that's what I was Googling. I was like, how long is it going to take for us to know? So, I mean, it's good that the turnarounds are pretty quick in this because otherwise it'd have to be quarantined until they find out. And what a mess. Okay, Dr. Mary Gillis, thanks so much for that insightful information.
And well, we're coming up at 6 again, so we have a couple of other things that are going to be going on. So we have other things we're going to be talking about to watch out for the coronavirus cons and how the coronavirus could be a little bit similar to the chickenpox.
Okay, we'll look forward to that. Thanks so much.